You respond to a parking garage for a possible assault victim. Police are on the scene. When you arrive, law enforcement is waving you over toward them. They are standing over your patient, a 35-year-old male, who is lying prone on the ground with a small puddle of blood around his head. You do not notice any spontaneous movement from the patient as you approach. An officer has secured a tire iron believed to be the weapon approximately 10 feet from the patient.
Okay. So proper PPE first thing. I would assume, but double check. Is the scene safe at this point?
Yes.
Okay. Um, Assuming that the mechanism of injury is potential blunt force trauma, is he the only patient?
Yeah.
Okay. Um, and where did he appear to? Where was the blood coming from?
What's that?
Where was the blood coming from? You said his head.
Yeah.
Okay. Um, could potentially be a neck injury, so I will apply a C spine to him. Um, Impressions of the patient. He uh, does it. What does the skin color look like? Aside from like the bleeding, does he appear to be breathing okay?
Breathing. Um, Rapidly with irregular pattern.
Okay. Um, and is he does he respond to any sort of pain?
Let's see.
You did say he was unconscious, correct?
Um, it just says you do not notice any spontaneous movement as you approach.
Okay. Is the patient does he appear to be awake?
Unresponsive.
Unresponsive. Gotcha. Okay. Okay. Um, um, so I guess his chief complaint would be he is unconscious. Okay. Easy enough. If I want to open up his mouth and check his airway, does he appear? He appears to be breathing, and does his airway appear to be clear?
Three front teeth have been knocked out, blood in the mouth.
Okay. I would like to suction uh, the blood. Um, does he appear to have adequate chest rise and fall?
Um, it says, where are you at? It does not say anything about adequate chest rise and fall.
Okay.
It just says irregular pattern.
He's irregular. Okay. Um, okay. So he somewhat appears to be breathing at least. Um,
It also says very fast, then slow, then period of apnea, then repeat.
so he's difficulty breathing. Okay. Um, after suctioning his airway, I'd like to put him on a non-rebreather mask. Um, Probably at 10 milliliters. Checking his skin color. Does the skin appear to be? Is there any sort of? Is it flushed at all? What does the skin look like?
Pink, warm, and damp.
Pink, warm, and damp. Okay. Um, okay. So I'm going to put some gauze on the back of his. Or is the blood coming from the back of his head?
Yes, the back of his head.
Okay.
It says venous bleeding, no gushing or spurting.
Okay. Yeah, I would get like a small stack of gauze, place that underneath his head to help kind of help with the bleeding, or at least absorb some of it. Then maybe apply some bandages to it. Um, um, I am going to call ALS for this patient to get him transported. Um, okay. I'm going to get his vitals now. So if I check if I count his respirations and check his pulse, I'm going to go with if I check his radial pulse.
Rapid bilaterally.
Okay. How many beats per minute?
58.
58 beats per minute. Okay. And his blood pressure?
186 over 118.
186. Okay. And I count his. How many respirations does he have per minute?
26.
And his SpO2?
SpO2 is 94.
94. Okay. So I would now attempt to obtain a sample history from this patient, though he is unresponsive. I cannot do that. So I'm going to begin a secondary assessment. So I assume about palpating the back of his head, it's probably there's probably gonna be a soft spot. Checking his pupils.
Unequal.
Unequal. Okay. Um, okay. Moving down to his chest. Does he appear to have a does his trachea appear to be shifted at all?
Um, Let me flip the page. No tracheal shift.
Okay. Does he have JVD?
No JVD.
No JVD. Okay. Um. Okay. If I begin palpating his chest.
Abrasion and bruising to the left shoulder area.
Okay. No bleeding though, just bruising.
Correct.
Okay. If I was to so is this assuming I lifted his shirt up, I would see the bruising.
Correct.
Okay. Okay, moving down to his abdomen. If I palpate around his ribs and his stomach.
Stable. Abdomen soft and non-tender in all 4 quadrants.
Okay. Moving down to his lower extremities. If I check his if I palpate his inner thighs.
His thighs.
Yep.
So pelvis.
What?
What about his thighs?
No, if I check his lower extremities, I move down to his thighs.
Okay. So extremities, there's no major injuries.
Okay. Are you saying extremities as both lower and upper extremities?
Lower.
Okay. Checking his upper extremities.
Upper extremities, also no injuries.
Okay. And if I was to carefully roll him over and check his backside?
No injuries noted.
No injuries noted. Okay. So I don't notice any major secondary injuries aside from the bleeding. I would probably reassess the patient within 5 minutes and transport.
Okay.
Okay.